Hello, in this video we will be addressing frequently asked questions about dengue fever. Click on a particular question or watch the entire video to find out more. First off, what is dengue fever? Dengue fever, also known as breakbone fever, is a disease with symptoms such as fever, exhaustion, a measles-like rash, muscle and joint pain, and retroocular headache. Dengue fever can evolve into two different, more serious forms: dengue shock syndrome, which causes blood pressure to fall dramatically, and dengue hemorrhagic fever, in which small cases of internal bleeding, the reason for the measles-like rash symptom, may lead to more intense internal hemorrhages. This is linked to the contraindication of certain drugs in cases of suspected dengue fever. Why are some pharmaceutical drugs contraindicated in cases of suspected dengue fever? Certain drugs, such as ibuprofen and aspirin, can have coagulation-diminishing effects aside from their desired effects. For someone with dengue, this can have devastating consequences. The low platelet count caused by the disease will be exacerbated by the blood-thinning effect of the drug, increasing the risk of hemorrhages. For these reasons, if you believe you have dengue fever, do not self-medicate, especially not with anti-inflammatory drugs. Please see your doctor if this is the case. How can dengue fever be diagnosed and treated? In endemic areas, dengue fever is usually diagnosed symptomatically. That is, a physician will examine a patient for typical dengue symptoms and diagnose him accordingly. There are a few quick tests medical professionals can resort to in order to detect the virus in a patient's bloodstream. So if you present some of the symptoms related to dengue, please see your doctor as soon as possible. There is still no treatment specific for dengue fever, only for its symptoms. During the course of the disease, the plasma or liquid part of the blood will leave the blood vessels and head to other organs. Therefore, it is essential for the patient to rest and drink plenty of fluids so as to replace that which was lost by the blood. How is dengue fever transmitted? The dengue virus is transmitted through mosquito bites of infected female mosquitoes of the Aedes genus, especially Aedes aegypti, known for its white bespeckled body. Female mosquitoes become infected with the virus after feeding on the blood of infected humans. In other words, they can only transmit the virus if they have already picked it up from an individual with dengue. The virus takes 2 weeks to contaminate the insect's saliva. From then on, the female will be able to spread the virus in a human to insect to human cycle. The virus can also infect the mosquito's eggs, but male mosquitoes born from these eggs cannot transmit the disease. Currently, this mosquito lives and reproduces throughout hot regions all over the world. This species is the cause of about 50 million cases of dengue fever and around 20,000 deaths annually, most of which occur in densely populated urban areas. Since this video has started, over 130 people have been infected with dengue. In the next 30 minutes, someone will die from dengue. How did dengue first reach Brazil? The dengue mosquito, also known as the yellow fever mosquito, is not native to Brazil. It was brought over from Africa by ship during the colonial period. The dengue mosquito was almost eliminated from Brazilian territory in the 1950s in an effort to contain other diseases spread by the same mosquito. However, due to globalization, it was reintroduced by cargo ships and airplanes and is currently considered a national plague. There are reports of dengue in Brazil from as early as the late 19th century, but the first documented case of the virus was at the beginning of the 1980s in the city of Boa Vista. In 1986, there were epidemics of the disease in Rio de Janeiro and some state capitals in northeastern Brazil. How does the virus cause its disease? Like all viruses, dengue virus needs a host cell, like ours, to multiply. After being injected into our bloodstream, the dengue virus invades white blood cells both in our blood and on our skin. After invading a cell, the virus takes over all of its main functions and begins producing countless copies of itself. These copies then leave the host cell, destroying it in the process, and moving on to attack other healthy cells, thereby spreading the infection. These white blood cells will then travel throughout our bodies and inadvertently spread the virus to several of our vital organs. What are dengue hemorrhagic fever and dengue shock syndrome? Dengue hemorrhagic fever is a more serious form of dengue fever that causes internal bleeding. Platelets are components of our blood responsible for coagulation. In other words, they prevent hemorrhaging under normal circumstances. If cells in the bone marrow were to become infected with dengue, platelet formation and blood coagulation would be severely compromised, thus leading to dengue hemorrhagic fever. As we previously mentioned, dengue shock syndrome causes blood pressure to drop drastically. As the dengue virus infects our entire bodies, there is a widespread release of substances that allow for the passage of blood from our veins and arteries into our bodily tissues. The flow of blood from our blood vessels to our tissues is so great that it leads to swelling and a major decline in blood pressure. Without adequate blood pressure, blood cannot be pumped to our vital organs, which would then lead to multiple organ failure. Why is dengue virus more dangerous the second time around? There are 4 human-infecting serotypes of dengue virus, and building immunity against one will not protect you from the other 3. Our organism can remember microbes that have infected us before, and upon second contact with said microbe, our body generates a quicker response than before thanks to specific antibodies. The antibodies we produce against one strain of dengue are not powerful enough to eliminate the others. The antibodies, in fact, become counterproductive against other strains. They bind to the virus but are unable to inactivate it. This futile binding attracts white blood cells, causing them to fall into a trap, become infected, and continue to spread the disease. How can dengue fever be avoided? In endemic regions, this sort of information is generally well publicized. Currently, the main approach to stopping dengue is to eliminate it at its source. That is, to keep the vector mosquito Aedes aegypti from proliferating. The dengue mosquito's larvae grow in stagnant water, so leaving out receptacles, from buckets to tires and even bottle caps, with exposed water is not a good idea. You can also avoid becoming infected with the use of insect repellent. If for whatever reason you do get infected with the dengue virus, please continue to use insect repellent because you will have become a reservoir from whom other mosquitoes can pick up and spread the virus. Aedes aegypti mosquitoes can also transmit other viral diseases, such as yellow fever, chikungunya, and Zika fever. What have scientists been doing about this? Scientists have taken several different approaches to combating the disease, and some studies done in Brazil have reached promising results. A group of scientists from the University of São Paulo, led by professor and researcher Margareth Capurro, has been freeing infertile transgenic mosquitoes in the vicinity of the town of Juazeiro in Bahia state. These males compete for females just as the wild males do. However, the transgenic offspring are defective and cannot mature into adults. In the nearby community of Mandacaru, there has been a 96% decrease in the dengue mosquito population. Both the local population and government are thoroughly satisfied with these results and urge for this project to be taken to other communities at risk. In order to learn more about the transgenic mosquitoes being tested in Bahia, we interviewed Professor Margareth Capurro. Click the link on the screen to watch the interview with English subtitles, or click the link in the description below. Moreover, many other laboratories have been hard at work developing vaccines for dengue fever. Once ready, these vaccines will help our immune system by simulating a dengue virus infection, thus stimulating antibody production against the virus. A truly effective vaccine would protect against all 4 strains of dengue at the same time. This poses a challenge for researchers involved in developing the vaccine. For more information about dengue fever, please visit our wiki. For information on what you can do to help combat dengue fever, click the link on the screen or in the description below. If you have any other questions, do not hesitate to ask in the comments. In the fight against dengue, we all have a duty, so stay informed and be proactive. Share this video and help spread the word.